topic is management of mucositis, nausea, and vomiting. So in this presentation, we will discuss the definition of mucositis, the sign and symptom involved in mucositis, assessment, mucositis grading is prevention, treatment, and nursing implication, nausea, vomiting types, and the pathophysiology, causes, diagnosis, grading, and treatment. So as far as definition of mucositis, mucositis is the injury that occurs to the mucosal barrier of the gastrointestinal tract, so mucosal lining that is disrupted, it is called mucositis. It may be due to many chemotherapy or some other causes. This lead to several problems in the patient that includes pain, nutritional deficiency, the inability of patient to eat, and increased risk of infection. Mucositis is probably the most common debilitating complication of chemotherapy. Mucositis, it generally appears 5 to 10 days after start of chemotherapy, and usually it lasts from 1 week and to several weeks. Here is a diagram showing mucositis of a patient, and we can appreciate the mucositis on tongue and mucosal surface. The sign and symptom of mucositis wall, these swollen and shiny mouth and gums really, but they can lead as well as sores in mouth and pain in mouth and throat. The patient may also develop some difficulty in taking and swallowing of food. Also, there is dryness, burning sensation, and pain while eating food. Increased mucus or thicker saliva in mouth is also sometimes seen. Yes. Hello.
Continue, Saira. Continue.
Yeah. Thank you, ma'am. Assessment of mucositis, grading of severity to accurately measures the grade or those observe the grade of mucositis is necessary for treatment. And as early as this problem is identified, the intervention reduce the risk of systematic infection and prevent unnecessary suffering of this patient. Scoring. So initially, the purpose of scoring is to reduce the initial situation, and if possible, scoring should be done on daily basis with the help of a measuring instrument, including a pain VAS, validity, reliability, and responsiveness, and managed. So mucositis grading scales. So it has 5 grade. The grade 0 means no mucositis. In grade 1, the patient is able to eat, intake is significantly. In grade 2, the eating ability is significantly decreased. In grade 3, there is significantly low intake, almost nil, and in grade 4, there is no intake. Oral assessment. So in oral assessment, we can appreciate in this diagram that we have to see in a full open mouth, the inside of upper lip, the inside of lower lip, and they in the soft palate, the lateral and ventral aspect of tongue, and right and left side of cheeks from inside floor the mouth. These diagrams show the mucositis of different grades. So in grade 1 mucositis, and then grade 2, then grade 3, and then grade 4. In this way, we can now take about grade 2 arrhythmia ulcer. Significantly swallow a food is compromised. In grade 3, the ulcer is excessive arrhythmia is increased, unusually the bleed as well as. And grade 4, the bleeding is usually present and the mucositis is to the extent the patient is unable to eat anything and swallowing is compromised. Talking about prevention and treatment, usually it's not possible to completely stop mucositis, but measures taken at proper time and as early as possible help to improve the patient and to evaluate the symptom of this problem. The first step The first step is to see density. Second is mouth care, important in BMT nursing, with the principal objective of cleaning the child mouth. Regular and thorough mouth care is daily. Cryotherapy. After the cryotherapy, for this purpose, we can use ice cubes for 30 minutes in mouth, and the patient is asked to hold the ice water in mouth and for almost some time, and then swirl it and spit it out of the mouth. And usually this practice is done before and after and during the mucotoxic agent treatment in patient. As far as nurse team is concerned, the responsible for of a nurse it to reduce of a nurse is to educate the parents for proper mouth caring, brushing, and the proper mouth care, rinsing of mouth with switch and spit before and after every meal and before the bedtime. So this the job of the nurse is to educate the parents regarding this mouth care. Some additional aids include B fluoride tablet and electric toothbrush. Chlorhexidine is not recommended except if unable to brush teeth. If a patient develops mucositis, so there might be in need to increase brushing with a soft brush, and it is important to brush very gently so that no harm and no damage to the mucositis lining. Further damage should be prevented. And the mouth should be kept moisturized and prevent any source of infection. For lips care, petroleum jelly is a common thing to use, and nurse should always encourage child and parents and with this oral hygiene. Do not forget, despite the acknowledged importance, oral care is one of the first things to be set aside when workload are excessive. The next topic is our today presentation is nausea and vomiting. What is nausea? Nausea is a disorder characterized by a queasy sensation and or the urge to vomit. Vomit, a disorder characterized by reflexive act of ejecting the contact of the stomach through the mouth. Types. There are two types, acute onset and delay onset. So within 24 hours of chemotherapy, it's acute onset, and more than 24 hours of chemotherapy may be up to 2 to 3 days. It is called a delay onset. The pathophysiology is the direct activation of vomiting in center in the brain stem by chemotherapy. The other pathophysiology might involve the damage to the gastrointestinal tract mucosa, causing vagal stimulation and release of relaxive stimulation of the vomiting center. And also the radiotherapy induced neurotransmitters release the causing vomiting. So there are three mechanisms of vomiting due to chemotherapy. Causes. The causes include induced directed by conditioning chemotherapy. High hematic risk is greater than when cyclophosphamide greater than 150 mg per meter square, and carmostene when its dose is greater than 250 mg per meter square. Moderate hematic risk, the frequency is between 30 to 90%. Busulfane less than 250 mg per meter square, and the minimal to low hematic risk is when the frequency is less than 30%. So the drug that can cause vomiting are etoposide, fluconazole, methotrexate greater than 50 mg per meter square, voriconazole, traconazole, and cotrimoxazole. Some hepatic diseases, hepatitis, they also lead to vomiting. Some infection like cytomegalovirus infection, herpes virus, graft versus host disease, adrenal insufficiency, and pancreatitis. Diagnosis is on the basis of symptoms. The grade of nausea is 3. Number 1, loss of appetite. Grade 2, induce oral intake decrease with significant weight loss, and grade 3 include inadequate oral caloric and fluid intake, and they may require hospitalization, TPN, or tube feeding. Grade of vomiting. The 4 grade of vomiting. Grade 1 to 2 episode in 24 hours. Grade 2 includes 3 to 5 episode in 24 hours. The grade 3 is greater than 6 episodes separated by 5 minutes in 24 hours that require tube feeding, TPN, or hospitalization. And grade 4, it's life-threatening and urgent intervention is included in grade 4. Treatment of nausea and vomiting is number 1, prevention, and after that, delayed nausea should be treated with scheduled anti-emetic for 2 to 4 days. Nursing intervention of nausea and vomiting. Nursing intervention of nausea and vomiting. Nurses are responsible for assessing the causes of nausea. What are the events leading to the development of nausea and vomiting symptom, and communicating the information the physician. Educate and assist patient about oral hygiene. Eliminate things that can cause nausea and vomiting like perfume, dressing, or any other things. And maintain a good fluid balance. Allow the patient to use non-pharmacological nausea control techniques such as relaxation, guided imagery, music therapy, distraction, introduction of cold water, ginger product, and room temperature, and also given frequent and small amount of food that appeal to the patient. Use simple food taken take broth, rice, and bananas. Take the patient to avoid food and smell that trigger nausea. Positions the patient upright while eating and for 1 to 2 hours post meal. Keep room well ventilated. Any question?
Very well, Saira. Any
Thank you, sir.
Any comments, questions? You're welcome. Okay, then we'll move on to Ufika, and then we'll take the quiz and